Hi all, Dr.Raman Sakhuja here, consultant psychiatrist and an honorary professor of psychiatry with the University of South Wales. Welcome to the YouTube channel. We make videos on common mental health topics and give you tips to manage those conditions as best as you can. So today, we are very fortunate that I have with me a very experienced guest, a very experienced child and adolescent psychiatrist is Dr. Sharma, who has very kindly joined us to talk about certain diagnostic challenges in ADHD. So let's go straight into the video. First of all, let me welcome you, Dr. Sharma, on this channel.
Oh, thank you very much.
And today, one of the things that I really wanted to discuss with you is that, when in my practice as an adult psychiatrist, I see quite a lot of people who come and ask about ADHD assessments. And when we start doing ADHD assessments, what I find is that there is a lot of things that we have to sift through, and there may be a number of conditions like sleep disorders, there may be dyslexias, ASDs, or neurodevelopmental conditions. In adults there may be mood disorders or even personality disorders that can look quite similar to what ADHD's features are. And the skill of the assessment really lies in being able to tease all of those conditions apart before saying this is ADHD. So I wonder what sort of challenges that you face when you see children and adolescents for ADHD.
I think it is very interesting to know that presentation changes according to the age. In the early years, particularly we're looking at anywhere under the age of 10, the presentation is very different to the late adolescence. Now, we have to look into some common underlying conditions which mimic ADHD, such as dyslexia, learning difficulties in the younger age group, and oppositional behavior disorders. Plus, sometimes it is the whole family dynamics with no boundaries, which may present very much like ADHD. However, in the later part, the late adolescent age group, they may have underlying anxiety. They may even have learning difficulties for which they might be struggling in school in general, and that results in a lot of ADHD type presentation.
That is really interesting. And so how do you in your practice tend to tackle those challenges?
As per the guidelines, we have to follow we have to gather information both from home and from school to rule out any underlying learning needs or any other oppositional kind of disorders. We need to engage educational psychologists who can at least tell us beforehand what kind of needs they have. A lot of times, they can be supported if they have learning needs, and that will automatically resolve a lot of ADHD features.
Right.
In the later part, again, if you rule out the anxiety, depression, sometimes in the late adolescent period, late adolescents may present with impulsive overdoses, self-harm behaviors, which are more likely due to the uncontrolled ADHD. So if you scratch the surface, you're likely to find ADHD features. Diagnose them, treat them, their mood also improve. So if we have to be very holistic, consider all possible comorbid conditions and then narrow it down.
Right. So that's very a useful point that you mentioned. So when we are doing assessments in adults, we rely a lot on not only just the adult, because I guess adults are much better in reflecting back on their
Yeah.
lives, but we also look at the informant questionnaires and information from them, and I tend to also do the QB check. And I guess in your speciality, you would be reliant a lot on the school system, but then there are people who may not necessarily present with the typical features early on, and it's only later on when the demands of life increase, that's when they decompensate and the disorder starts to show up. So,
Absolutely. It happens quite commonly in my clinical practice, particularly if they are mild, on the mild spectrum rather than on the severe end. They don't necessarily present early on. So when the demands increases, especially in the higher school age group, they start to present with a lot of inattention difficulties, a lot of not necessarily hyperactive, but restlessness kicks in. The
Right.
fidgetiness is far more noticeable, and they struggle to concentrate, and their academic performance starts to go down. So that is one of the one of the common presentation. If you miss it early years, closer to the exam times, or say year 11, 12, presentation becomes much more noticeable.
And I guess what we sometimes see that specifically in women in adults is they haven't been diagnosed early on. Maybe sometimes in university, that's quite a lot of times I see that. But then sometimes even later on, where low grade problems have been prevalent for a long time, but closer to menopause, things start to decompensate. And I guess we can talk about that at another time. But what I'm hearing is that whether it's an adult or a child and adolescent, the essence or a common theme is that we are not just relying on a checklist of symptoms, but there is a lot of work to be done to distangle the various components that may be present, or almost, you're taking the lid off or taking layers off from different things before getting to the core and saying and pinning it down to ADHD.
Absolutely, absolutely. I think that is vitally important to make sure that we have looked into lots of other aspects of the presentation. And tools are helpful, but they are not necessarily the diagnostic in nature. So evidence is absolutely important.
Okay, that's really really helpful. So, is there anything else that you would want to share with the viewers?
Just one more thing. You mentioned something about the women. Yes, the girls particularly, they present slightly differently to the boys, and often they may not present till the later age, and they may present more with comorbid conditions or comorbid presentations such as depression or anxiety. So we just need to be mindful of that.
Actually, having said that, that gives us a natural sort of lead to talk about challenges in girls and women, and perhaps we can talk about that next time we meet.
Absolutely.
So, thank you very much, and thank you very much, Dr. Sharma, for
Thank you.
being part of this. Obviously, we are going to meet him more often and talk about different things. But in the meantime, if you have liked the contents of this video, please like, share, subscribe, comment, and do not forget to press that bell button icon so that you get the notifications for all the upcoming videos. And we will see you very shortly. Take care.